You're still watching the program TV Splash, this edition on this wonderful Saturday, and of course, it's time for the personality segment of the program. As usual, I have an interesting guest in the house. Join me as I welcome Dr. Ngozi Frances Onya. You're welcome to the program.
Thank you very much.
Of course, she's a medical practitioner, or who you can call a medical entrepreneur. Dr. Ngozi Onya, MBBS, FWACP, MBA, CTH, is a 1982 medical graduate of the University of Ibadan, specialist pediatrician, fellowship of the West African College of Physicians, WACP, has an executive MBA from the prestigious Lagos Business School, LBS, certificate of travel health from the International Society of Travel Medicine, and has worked both in private and public health sectors of Nigeria over the last 37 years, with a 10-year stint as company medical advisor of Nigerian Breweries PLC from 2000 to 2010 to be specific, leaving to establish our own hospital, and of course sees herself, as I said earlier on, as a medical entrepreneur. Once again, let me welcome Dr. Ngozi Onya to the personal segment of AN Splash, OGTV Splash this morning.
Thank you very much.
Yes, let me first start on this premise. Who is a pediatrician?
A pediatrician is a specialist doctor that takes care of the health needs of children.
Now, do you want to say we have enough in Nigeria, especially considering this issue of child immortality that we've been having in recent time? Or are we safe now?
Certainly, we don't have enough doctors in Nigeria. The World Health Organization recommends a ratio of 1 doctor to 600 per population. In Nigeria, it's 1 doctor to 6,000. So, we don't have enough of any kind of healthcare worker, and definitely not enough pediatricians in the country.
Why should we have specialists to take care of the health needs of children? I mean, for us to now have enough pediatricians, so to say, why should we have, once you are a doctor, aren't you qualified to take care of any health issues? Why should we have specialists for children?
It requires specialists for all ages and different strata of the society. Healthcare needs at various levels. There's primary care, secondary care, and tertiary care. For primary care, any doctor basically can take care of primary care, and that's what majority of the population will require. But then sometimes things get a little more complicated, and then you need some degree of more training and competence to take care of those. Those are the secondary and the tertiary, and that's where you require specialists in all disciplines.
All right, I know that you worked in the public sector before you went ahead to establish your own. I want to dip into your experience somehow because I've been to hospitals before, and I'll see mothers bring their children to hospital. I say like 150, and I see that maybe 1 or 2 doctors trying to attend to them. How do you feel when you were faced with this situation? How were you able to cope?
Luckily, I was a lot younger at that point, because that's usually the residency, the training period. I think hard work and empathy are key competencies every doctor will require. So hard work and empathy. So we just keep going. Overworked most of the time, but we learn to work hard, learn to work long hours, and you don't think about it, you just get to it and do what you have to and what you can. So you do something called a triage. You take the sickest children first and attend to them, and then go down the ladder like that.
Even though you are no more there, but definitely you must have an ear to the ground. Do you want to say that looking at the problems then and looking at where we are now, there has been an improvement? Talking about really getting the medical needs of these children as and when needed right now. What do you hear? What do you think the situation is? And what do you think all stakeholders in the health sectors should try and do?
I think there's a good side to it and there's a not so good side to it. The good side is that healthcare has developed. It's a very dynamic discipline, and every day new innovations. So yes, it's getting kind of easier to diagnose, faster, and treat better. that's on the global level, and somehow that had trickled into Nigeria as well. I practice in the upscale part of Lagos, so I tend to have access to a lot of technology that many of my colleagues in the more rural areas may not. So yes, in that way, things have improved since I qualified. But on the other hand, things have also worsened. We have the massive brain drain. There's a population explosion in Nigeria. The ratio of doctors to patients is getting worse and worse, or less and less. And so yes, it's more challenging in the public health sector now than it was. But I must say that Lagos State is doing a good job. So what I've said is a general comment for Nigeria as a whole, but Lagos State in particular, I think things have improved, and I think people who work in the public health sector of Lagos will confirm.
Can health be free in Nigeria?
Health cannot be free anywhere in the world. Health is not free anywhere in the world. Somebody somewhere has to pay for health, and that's a fact. Healthcare workers are some of the most specialized, most highly skilled and highly trained workers in the world. Therefore, they will be paid very well. And there's no way you can employ healthcare workers and pay them without somebody else bearing the cost. So in other parts of the world where we think healthcare is free, people are paying taxes. The National Health Scheme of the UK, for example, is a good one, where people are paying taxes of up to 40%, from which they now are able to provide healthcare for everybody. In America, it's health insurance, but healthcare cannot be free. But I do agree with you that we should keep out-of-pocket payments for healthcare to the barest minimum. But that is not free. It just simply means that there's a different way of paying for healthcare.
Just like we have in the area of education, I think it's also happening in the health sector. People will tell you that it's how rich you are. That's how you can determine the kind of medication or medical attention you will get. Well, is it true that you can only get the best from the private clinics or private hospitals?
I think everywhere in the world. I mean, even in Yoruba, we say Obetodun. So everywhere in the world, with more resources, you can obtain more. But having said so, there must be a basic minimum below which we should not go, which is just good enough. Very often the difference between one drug and another is just a matter of branding and packaging. There's no difference in the molecule or how active the medication is, but one looks nicer than the other and costs 10 times more than the other. But they both do exactly the same thing. So there's a basic minimum below which we should not go in healthcare for everyone. Everyone is entitled to healthcare, basic healthcare. But having said so, those who are wealthier will probably access what appears to be better quality care.
All right, you're still with my guests on the personality segment of the program on this edition of OGTV Splash with me, Hakeem Akitunde. She's still Dr. Ngozi Onyia. We'll take a break. I'll be right back. You're welcome back. Of course, still have as my guest a medical practitioner, a medical entrepreneur, Dr. Ngozi Onyia. Yeah. From what I know of you, you also have an executive MBA from the prestigious Lagos Business School. What is the connection between health and the Lagos Business School here? Is it part of why you want, or we should refer to you as a medical entrepreneur?
Well, I'm in the healthcare business now. So what I do, I run a hospital. Okay. And healthcare is a business, just like any other business, and it has to be run on the same business principles of profit and loss, so the same business principles apply across every business. Any business is set up to return to make returns to shareholders, or to return profits to shareholders. So we must think of the inputs and the outputs, but think of the top line and the bottom line. So healthcare is a business.
So what is it about this travel health?
Well, global travel has exploded. Every year, almost 2-3 million people are traveling all over the world, from across across global zones. And with travel, now a trip that used to take 2 weeks by boat now takes 6 hours by air. So of course people are able to, diseases travel with people. And diseases that are foreign to certain lands now are able to move very quickly into other lands, into places where people have no immunity because these diseases are strange to them. So travel health is about keeping travelers safe. So the traveler is safe going to a strange land, and the land that the traveler is coming into is safe with welcoming these travelers. That's what travel is.
Entrepreneurship or entrepreneur is these are two well-known words, and I know that when you say you're an entrepreneur, maybe your creativity, your innovation in whatever you believe in. And of course, we've seen most entrepreneurs who are not even entrepreneurs on what they study, on what they're based on. So, what is this about being a medical entrepreneur?
Well, I'm running a medical business. That's it. So I'm running a medical business.
What new things are you putting in, or are you bringing in? Have you brought in that will make us to actually refer to you or agree with you that you are a medical entrepreneur?
Okay, I started an outpatient clinic 9 years ago with 1 bed for observation. Okay. It has since then grown from an outpatient clinic with 1 bed to a 20-bedded hospital with 2 branches, employing over 100 people, providing healthcare across the spectrum from primary to secondary to tertiary. We have an operating theater, we have an intensive care unit, we have a labor ward, we have a travel clinic, we have a health assessment unit, we have a laboratory, pharmacy, radiography. So the entire spectrum of healthcare is covered in the hospital. Well, I started it as a one-man business. Now I have about 6 partners who have joined with me and providing healthcare across. Next we are going to introduce our endoscopy unit, which will start in August. So
I know that providing quality health for the citizenry goes beyond fantastic salaries for the doctors. Yeah. Despite the fantastic salaries you still pulled out and you're on your own, you're enjoying it. So what would be the message for government, for example, who are the key stakeholders in the health sectors in terms of having the basic necessities that is needed to provide, as you said, average, we cannot get the maximum and average healthcare for the people, especially looking at the downtrodden who might not be able to afford what you guys charge at the private clinics.
Health insurance is the only way to go. The principle of health insurance is that the majority of the population will be healthy, but they will pay something to a common pool to compensate for that unhealthy and unfortunate minority, knowing that that unfortunate minority can be any of us at any time, but we all contribute to health insurance. So health insurance is the only way to achieve universal health coverage, and it's the only way to have an equitable healthcare system in any part of the world. And that's the truth. So the government needs, health insurance covers less than 5% of our population in Nigeria. In a country like Ghana, our next door neighbor, it's about 30%. In Rwanda, it's well over 90%. So the government's challenge is how to ensure that health insurance is embraced by more people in Nigeria.
All right, I know that all work without play makes Jack a dull boy. Not only Jack, could make me Hakim, and I know could make Dr. Ngozi too. So, as a medical practitioner, you have time to relax at all? If you do, how do you relax?
Plenty of time to relax. I make time to relax. So I walk in the morning, power walking, and that's a very big part of my life. I listen to music, I pray when I walk. Yesterday we climbed the Olumo Rock. That's having fun. I travel quite a bit. And when I travel, I make sure I relax. I go hiking, I go swimming, I dance, I go partying. I like to party, and yeah, eat out, have drinks. So yes, I have a lot of fun. I have a grandson, and my grandson, I take him out. We go to the beach. We do all kinds of fun things together. I take him to the playgrounds. So yes, I find many ways of relaxing.
There has always been this issue that medical people don't really have too much time for their family. Is it true? How is it with you and Oga? And of course, your immediate family. I know you are a grandma now, but I mean, let's take it from when you were young and you were on call most of the time so that people would learn from that experience. How was it? How were you able to manage the intensity of the job and, of course, the emotional aspect of taking care of Oga?
I must tell you, it was very challenging. As a pediatric resident, we used to be on call every third day. So every 3 days you're on call, which means you don't come home till the end of the next day. And also we used to have weekend calls once a month, which means you went to work on Friday morning and you didn't get back till Monday evening. But it was part of the training, so we're prepared for it. And I think anybody who gets married to a doctor knows it comes with the territory, and there's nothing anyone can do. So yes, in the early years it was quite challenging, and the children complained quite a bit. But now it's much better, and I have plenty of time for my grandson. Time I didn't have for his mom.
Yes. You say you like partying. Can I also say you are a little bit of a socialite?
I don't know what a socialite is, but I like going to parties. I like, having fun, dancing, meeting up with old friends, having a drink, something nice to eat, yes.
Any particular brand of music, or depends on your mood?
I think so. But I like gospel, I like rhythm and blues. Then I think those are my two favorites, rhythm and blues and gospel.
All right, one of the most important reasons why we have a personal segment of this program is to inspire the youth, especially looking at the kind of changes we are having now. People there, the young ones, they don't actually want to believe in hard work. They want to believe that they want to rise quickly as possible. So when we have people who are on the top of their career through this stint of hard work, we also want to actually allow them to offer words of encouragement to people, especially the youth out there, on how to get to the top, and of course what it means to be hardworking.
The Opus Dei, the Catholic order that runs the Lagos Business School, they believe that work is redemptive. And I do believe it, that there's a lot of reward in hard work, beyond the financial rewards. That, to be honest, I liked you talking about me having a big salary. I wish I did. So financial reward, very poor, or relatively poor. But there's a lot of fulfillment and satisfaction in providing the service. Hard work. The Bible says all hard work leads to profit. So just stay with it. Do it the good old-fashioned way, one day at a time. That's the only way to be sustainable in your growth. Any shortcuts, usually in the long run, will come back to hurt you or haunt you. But when you do it the good old-fashioned way of working one day at a time, it ensures sustainability as well as profitability in the long term.
As a medical entrepreneur, assuming you have the opportunity of being drawn to the political aspect of the health sector, you know what I mean, special advisor on health, minister of health, commissioner for health, what's your thoughts?
The main thing I would pursue if I ever had that opportunity is health insurance, to see how we can drive health insurance coverage in Nigeria. I think that's the first primary challenge for anybody now who wants to provide good health care. Because that way we need to finance healthcare properly to be able to have a good healthcare system. So my first challenge will be ensuring that we move our health insurance coverage from 5% to a minimum of 20%.
On the last note, how do you see our health sector in the next couple of years? 10, 20, vision, I don't know, vision 20, blah, blah, vision from the health perspective. How do you see us realistically from what you've seen so far? in Nigeria?
I like to be positive. I think with the right people in position and with the right policies in place, the sky will be our limit. And that's what we hope for. That's what we look for.
It's my pleasure. Thank you very much for coming to this program. Of course, I've been having a chat with a medical practitioner or medical entrepreneur, Dr. Ngozi on here, and I'm sure that you must have enjoyed all the bits and pieces we've been saying since concerning the health sector, both in the public health and the private health. Of course, until I come your way again with another wonderful personality on the personality segment of the program. I hope we just let's see. I'll take a break and of course see you on the other side of the program.